Welcome to our first session. I am here with my scientific co-host of this evening, Eva Milinkovic. Good evening.
Good evening, Gerrit. Thank you. I'm really excited that the official part of EAO Digital Days is about to start.
Exactly, we're starting. And tell us, what are we going to learn more about and who is our expert tonight?
So, periodontally compromised patients, when are implant and options? We all know very well that periodontitis is one of the main reasons for tooth loss. It is logical to assume that teeth loss due to periodontal disease are going to be replaced by dental implants. But it is also known that this condition bears a high risk for biological complications development. Therefore, we're so happy to have with us one of the most experienced Italian periodontists. Over past 30 years, he specialized in periodontology, implantology, and prosthodontics. Besides his huge scientific work, he has an enormous clinical experience, so he is there in the field with his patients. So please, a warm welcome to our guest tonight, Professor Alberto Fonzar.
Yes. Thank you very much, Eva, for your generous presentation. Even too generous, probably. I'm really happy to be here and to share my experience with you.
Exactly. Welcome, Alberto. Now, just a quick word before we start. A reminder that our live audience can actually submit questions to our experts on the platform. On the right hand of the screen, you'll see a chat area where you can easily send in your questions. And those questions end up right here on my desk. That's how I know where you're all joining us from. And we'll try to address as many as we can in the second half of this session. Eva, Alberto, you're up. Let's talk more about.
Thank you. Dear Professor, I have done a bit of research, and scrolling through EAO programs, I found out this slide from EAO 2006 in Zurich, and I realized that you've been lecturing about almost the same topic.
That's true.
So I have to ask you, why are we still talking about this, and has something changed over the past 15 years?
So, a good question. Eva, you know, when after 15 years we are still talking about a subject, a topic like this, it means it's still an issue, and it is still an issue. What has changed? For so many years we have been convinced that implants cannot fail because they cannot get infected. Unfortunately, now we know that's not true. We know that peri-implant infections are quite common, and they can develop rapidly. And also we know that the risk factors are more or less the same of periodontitis. So a lot has changed in the last years.
I see. And we often hear that when you extract all the teeth, you cure periodontal disease. Is it really so?
I would like to give my answer by presenting you a case, a clinical patient I treated in 1995. You can see from the picture or from the x-rays was affected. This patient was at that time 38 years old, and she was affected by a severe aggressive periodontitis, what we, according to the new classification, I would say stage 4 and stage 3C, sorry. How I treated at that time this patient, I treated by a perioprosthetic procedure, I mean by a prosthetic rehabilitation, but before that I treated all the teeth by eliminating the pockets, complete pocket elimination, and also root resection of the molar, class C forcated molars. So you can be sure, before the final impression, no pockets were present in patient mouth. But you know, it didn't work like I supposed to, or I hoped to, because after few years, the patient, the teeth started to lose bone around the roots, and the development was quite, I say, rapid. And after 8 to 10 years, she has lost completely all the teeth. Then the last step, I was not so convinced, but the patient convinced me to replace the lost abutment with implant. But, and if you can see that picture, unfortunately, the implant infection started immediately. After 1 year, she had already lost the bone. And after 7 years, she has lost all the implants, so in a really short time.
Oh my God, this looks really like a nightmare. So
it is.
Why did all this happen?
Why? Because at that time, and that's an enormous mistake, and I try to learn from my mistakes. I consider the problem, the pockets, the furcation, only so the tooth-related risk factor. I completely didn't take care about the patient-related factors. This patient was affected by severe periodontal disease, aggressive, so the genetic component of the disease, and also she smoked 60 cigarettes per day. So, and other factors.
So yes, you showed us the case with patient smoking more than 3 packs a day. It's really a tough case.
Can you imagine even finding the time that is smoking all the time?
That's true. It's difficult to me to understand that. But it's not true, because how many patients, they smoke, they are even heavy smoker, 2 packs per day, 1 pack per day, and they have not periodontal disease. So this is the wrong way to face the issue to me. What you have to know today that has already changed completely the concept, the model of periodontal disease is we move from an infectious model to inflammatory model, and what we know now, the main reason of periodontitis, probably peri-implantitis, is an abnormal response of oral biofilm of the subject. The reasons are many different reasons. For sure, variation in the biofilm itself, variation in genetic, epigenetic, the stress. So many factors can play a role in periodontal disease, probably in peri-implant disease.
No, when you put it that way, I completely agree with you. I myself am coming from the country with the highest rate of smoking in the population, and in my much lower clinical experience, I do see patients smoking, but not anyone displays the same severity of periodontal disease. But to go back, in treating periodontal disease, when can you assume that you can save periodontally compromised teeth?
A tough question, Eva. You know why? Because theoretically, we could say whatever tooth, all if you take care only about periodontal disease, affected by periodontal disease. Sandro Crotellini could show using regenerative procedure, even in teeth they have lost about 100% of attachment. I have so many roots resected, molars, they after the 80%, after 20 years, are still supporting fixed prosthesis. So, but we can also think that in order to preserve the teeth in such cases, you need sophisticated therapy, but it's absolutely not true. As I would like to show you, a patient treated in 1988, so it was more than 30 years ago. You can see if you move now to the X-rays, this patient has lost overall in the upper jaw, frontal area, more than 80% probably of the bone support. All the furcation were class 3 furcation. And how I treated at the time this patient, I treated only with non-surgical therapy, and for sure the recall protocol about every 4 times per year. And if we can move now to the last X-ray control in 2021, you can see that she could maintain all disease except in 3 molars. In 31 years, she has lost 3 molars, only 3 molars. But please focus your attention on the bone. We have not lost bone. In other words, now we could also, if needed, we could replace some tooth by implants. So the concept that if in periodontal affected teeth must to be removed is not true. If you don't treat periodontal teeth, they must be removed. Otherwise, not.
I can see. Clearly, you have showed us that you've managed to preserve the bone exactly at the same level like it was 30 years before. Right. And it is also really important to know and to hear from you that periodontal compromised teeth can be saved. But if we go to a situation that the tooth needs to go out in a periodontitis patient, when are implants an option?
Thank you for the question, because first of all, we have to consider that for so many years, we didn't treat teeth affected by periodontal disease. Now we extracted them and replaced them with implants. Why? Because at that time we thought implants were not sensitive to peri-implant infections. Now it's not true. We know that's not true. And so to me, we have to make a little upside down the problem. First, we have to honestly evaluate and carefully evaluate the cost-benefit ratio, not only from an economic point of view, but also from a biologic point of view. Because, you know, not always keeping teeth is more conservative from a biological point of view. I mean, if in order to keep the teeth, I have to eliminate a lot of bone, as sometimes you have to do in the pocket elimination procedure or in crown lengthening procedure. Or you have to eliminate dentin, eliminate the endodontic tissues, like you do when you prepare the neighbor teeth for a bridge. But in my mouth, I would prefer an implant. I have to be honest. So this is absolutely to be evaluated, carefully evaluated. But yes, I think this is
careful evaluation and careful treatment planning. So if you're not satisfied with your periodontal treatment, would you go for implant?
Absolutely not. Coming back to the first patient, what I would do today, a denture from the beginning, because anyway, she has lost a lot of money, all the teeth, all the implant, and a lot of bone. So now the denture is much less stable compared to what she should have been 30 or 25 years ago.
I see. But do you have some cases to share with us with combined implant and periodontic treatment?
Absolutely, yes. You know, the prerequisite is you have to treat periodontal disease before implant placement, and also establish, I would say, a protocol recall has to be precise. Oral hygiene must be correct. It's not true that implant not sensitive to plaque. Please, we can move to the a picture, a first case treated in 2010. This is a patient affected also by over severe and also aggressive periodontitis. You know, at that time I treated before, for sure, the periodontal disease, and then I placed some implants. But you can appreciate after 11 years, both implant and teeth looks fine. And in the following case, please, you can move on the last one. Even a worst case, really a stage 4 and C classification, a patient treated the same way before periodontal treatment, then implant placement. After 11 years, both teeth and implant seem to respond in the same way to our treatment.
Thank you so much. I think we received some really important messages now.
Yeah, and Eva, the time is also flying while we're having fun, and questions are dropping in via the chat. Most of the people are really checking in. Good evening to you all. But I also have a question for you from Mark Smith in the United Kingdom joining us. You mentioned in the first case that you learned so much that you only looked at the tooth, but now also consider the patient. The question is, do you train your patients on dental hygiene before implant treatment? And in the case, for how long before you treat them? And when do you think they're actually ready for implants? So can you tell us a little bit about the patient management?
It's really a good question. First, yes.
Yes, so you train them.
So, you know, a big mistake, we make a dent to the patient at the beginning, and then we place implant at the beginning, and we don't know if this patient will treat correctly, will apply the good oral hygiene at home, and this is an enormous mistake to me. So how long, it depends on the patient. But no doubts, I will not go on with overall if it's a complicated and expensive therapy before I'm sure the patient can maintain what I do or I will do.
So you might agree that both unsuccessful periodontitis treatment and poor compliant patient are not candidates for dental implant treatment.
Please, sometimes the best choice you can do is not treating a patient. And we have to be honest with our patient. We are doctors, we're not sailors.
Exactly. Well, it's an interesting message here at the start of an implant dentistry conference, really rooting for the tooth. Now, Eva, time is almost up. So your task tonight is also to guard and safeguard the most important learnings from our sessions. If you had to say, what is the most important takeaway that we can take tonight from Alberto Fonzar?
Thank you, Garrett. What I have learned tonight is that it is really important to successfully treat periodontal disease. Then, of course, we can go for implants. And when we go for implants, to prevent further complications, we need to enroll our patients in individually tailored recall programs. Did I get it well,
Absolutely.
Professor Fonzar?
Absolutely. I would add not to forget the maintenance of therapy is probably more important than the therapy itself. If we lose the patient will lose teeth or implants.
Exactly. Very strong message here tonight. Eva, thank you very much for kicking off. Thank you very much for coming here to Paris.
Thank you.
Alberto Fonzar. And thank you for your very active participation. You can find all these sessions later in Channel 8 on our Video On Demand channel. Thank you for now.
Thank you.